Hi, I'm Tim Chaplin, Battalion Chief for Community Risk Reduction for Joliet Fire Department. This is Carl, our CPR mannequin that we use daily to train people in CPR.
And how you doing? I'm Brian Hertzman, Joliet Fire Department Community Paramedic.
Today, we're going to teach you hands-only CPR so we can save Carl's life. So annually, about 350,000 cardiac arrest events happen each year. 90% of those events end up with the person dying. Out of that 350,000, 70% of those cardiac arrests actually happen in the home.
So here at Joliet Fire Department, we would like to change all that. So what we're going to do today is we're going to show you how to do hands-only CPR. We're going to show you the steps of where to place your hands and the procedures that you need to do and follow to save a loved one or bystander that needs some assistance. So what you're going to do is if you come upon a person you're unsure if they're breathing or something's wrong with them. First thing we could do is make sure your scene is safe, make sure they don't have anything that can hurt you. What you can do is come down, pray with the person, hello, hello, hello. See if they have any responsiveness. If they're not responsive, roll them back onto their back. Support their head so their head doesn't go against the ground. Move some things away from yourself. So what you want to do is you want to look, see if there's any rise and fall of the chest. You don't see any rise and fall of the chest. The next thing you want to do, if you're by yourself, you want to get out your cell phone, double click the side button, 911 will come up, and put it on speakerphone, and you can put it down next to you. If there's somebody else there, you can point to them and tell them to call 911. If there's another person in the room, or it could be the same person, call 911, and if you know the place has an AED, get an AED. Then you're going to go ahead and find the area where you want to put your hands for CPR, which is right here between the nipples. You want to make an imaginary bullseye right here in the center of the chest, hard and fast, 100 times per minute. And all AEDs are the same. You're going to open them up and you're going to follow the directions. Some of the directions are on the packaging. This one has a nice one that's labeled.
Adult mode.
You're going to continue to do CPR while the AED is present.
Pull red handle to reveal pads. Do not touch patient.
So we're going to go ahead and follow along with what your AED says.
Heart rhythm.
So it's analyzing. You want to make sure no one's touching the patient in case there's a shock advice.
Clear.
So this is at this time, we're going to be shaking the patient.
Delivering shock.
We're going to deliver the shock,
Delivered.
and then right back to CPR.
Chest
Now I'm getting tired,
to the beat.
so I'm going to go to this person. Do you know
The heel
CPR?
of one hand
So I'm going to count to 3, and we're going to go ahead and switch out. 1,
on top of first
2,
hand.
3.
Push down hard, at least 2 inches.
So at this time, we're going to do CPR, and we're going to continue CPR till the paramedics arrive, which in Joliet is 3 to 5 minutes, and in most communities around our area have full-time paramedics and firefighters that will come to the scene, and we'll have all the life-saving equipment on their rigs. So once EMS arrives, what's going to happen is you're going to continue the CPR, but we have these machines that we're going to bring in. This is called our Lucas device, which does perfect compressions for a person. So what we're going to do is we have the cardiac monitor going. We're going to go ahead and breathe for this person because they're not breathing right now. We're going to start an IV, and then we're going to go ahead and put a tube down into their airway, and we're going to go ahead so we can breathe for them. So the airway in, so now we're going to go ahead and breathe and oxygenate this patient. Now, when we have our cardiac monitor on. So we went ahead and shocked the patient. And now you're going to see a heart rate on the screen right here. And thank goodness we were able to, from the good CPR that the bystanders did, gave this patient a good chance of living. So right now their heart is beating at a proper rate and time. So we're going to go ahead and pause our CPR. And we're going to go ahead and reassess the patient. We're going to continue to breathe for them. So in a nutshell, this is what would happen if your EMS arrive at your household or in a business.
If you're interested in receiving hands-only CPR training, you can contact us at Joliet Fire Department by calling us direct, 815-724-3500, and you can ask for Chief Chaplain.